Welcome to Cardiac Conduction and ECG or EKG components.
Keynotes are our mini topics, simple and straight to the point.
Looking at this cross-section of the heart, our cardiac contraction occurs first in the atria and then in the ventricles. Atrioventricular synchrony contributes to the normal function of our hearts. Our atrial contraction adds 15 to 20% to the cardiac output under our normal physiological conditions. However, an inherent delay in electrical activation of the ventricles is necessary for mechanical emptying of the atria to occur. Our normal cardiac impulses originate in the sinus node in the long superior portion of the right atria at its juncture with the superior vena cava. Then we have the AV node that is located inferiorly in the right atrium, anterior to the ostium of the coronary sinus and above the tricuspid valve. The speed of conduction is slowed about 200 milliseconds through the AV node. The AV node is anatomically a complicated network of fibers. These are our internodal pathways. They converge at the lower margin to form a discrete bundle of fibers. This is the bundle of His, or the AV bundle. This structure penetrates the annulus fibrosus and arrives at the upper margin of the intraventricular septum. Then we have the left and right bundle branches, which branch into our Purkinje system. It's also important to note there's a branch of the anterior internodal tract that resides on the inner wall of the left atrium known as Bachmann's bundle. The SA node is our heart's intrinsic pacemaker, and it beats in the right atria at 60 to 100 beats per minute. From there, we have the internodal pathways, the anterior, middle, and posterior internodal pathways. And we have the actual AV node that beats 40 to 60 beats per minute and also slows conduction through the atria by 200 milliseconds at this point in order to allow for ventricular filling. And as the electrical impulse leaves the AV node, it passes into the bundle of His and then down the bundle branches simultaneously. The ventricles begin to depolarize as the mid-portion of the intraventricular septum from the left side gives rise to the Q wave in our EKG or our ECG. The walls of the left and right ventricles depolarize simultaneously, contracting, and the speed of conduction through the ventricular Purkinje system is super fast. So let's look at this from an EKG standpoint and what actually happens. Our first upward deflection in our EKG is the P wave, and this represents atrial depolarization. Atrial depolarization initiates the contraction of our atrial muscle in the atrial chambers that force blood to open the atrioventricular valves, leading to a rapid flow of blood into the ventricles. From the beginning of the P wave to the beginning of the QRS is our PR interval, and this is the time the impulse takes to travel through the atria and the AV node. Then we see our QRS structure. Our Q wave is the first negative deflection after the P wave and represents depolarization of the septum. Our R wave is the first positive deflection following the P or Q wave. This is depolarization of the ventricles. Our S wave is the negative deflection following the R wave, and this is also depolarization of the ventricles. The T wave is the first upward deflection after the S wave. This is the repolarization of the ventricles. This is also the point at which, when we see elevation or depression in our leads, an ischemic diagnosis of the cardiac muscle can be determined. The impulse is then traveling back up through the heart, and we have the period known as diastole. This is where there is no electrical activity and the heart is at its resting state. The coronaries are being filled with blood, so the myocardial tissue can be reoxygenated. This point of the line is also our isoelectric line. This is the neutral point where no electrical activity is occurring. The other thing to note is our QT interval, and this is really important when patients have long QT syndrome. This can lead to sudden cardiac death. It's usually in young athletes, but certain medications can also cause an elongation of our QT interval, so it's important to be mindful and measure. I want to thank you guys for watching. That concludes our key notes on cardiac conduction and EKG components. Comment down below if there's a topic you are looking forward to.